Hello, everybody. I know we're getting started a little bit later, but I think we'll figure it out. But
This is going to run about an hour and a half. So we'll be quick.
So my name is Jason Stewart. I'm with Catalyst Pharmaceuticals, and we're welcoming Dr. Patrick Brown today he'll tell you where he's from, but I think we've done Ohio, Maui, Carolina,
Texas.
Minnesota,
Texas.
and he likes the brisket in Texas.
Yep.
So anyway, with that being said, Dr. Brown.
Thank you guys. Thanks for hanging out. Thanks to my friend, what's your name?
Scott.
Scott, who got us in this room. Because no one wants to kick Dr. Sankar out of a room. My name is Patrick Brown. I'm a pediatric epilepsy doctor, but I'm really talking to you guys today just as a guy with epilepsy. It's a lot easier for me to do the talk as like the pediatric epileptologist and to give you guys information. And part of this talk is, the title's Normalizing Epilepsy. It's really just my journey and my path is trying to like make peace, being a guy with epilepsy and also within kind of the epilepsy world. With this crowd, since we're running a little late, I'm going to skip over some of my comedy material that was at the beginning, but I think you guys will be a good audience. I'm going to tell you just 3 stories, okay? So this will be easy. I'm going to tell you about a library. I'm going to tell you about some 3rd graders and a microphone, and then I'm going to talk to you a little bit about a knock on my door. Are we good? Y'all got that? Library, 3rd graders, a microphone, knock on my door. So when I was 16, maybe 17, back in 1993, I had a seizure. Sunday morning, I was sitting next to my mom, getting ready for Sunday school, as one might, in Nashville, North Carolina, like my little tiny town. And I remember telling her, like, I think I'm gonna get some cereal, or fix a bowl of cereal. And the next thing I remember was maybe waking up in the ambulance, a brief flash, and then I remember being in the emergency room. Now, as the legend gets told, or as the tale was told, my mom screamed, and I don't know how many, if we have some moms here, you may know like what that scream feels like. My dad was in the shower, as dads usually are, maybe, so he came running out, buck naked, dripping wet, and they called the ambulance and got me there. Now, in Nashville, North Carolina, it's a town of about 8,000. My mom's the mayor currently, if that gives you any idea. She's in the middle of like a really heated re-election campaign against Donald Street, who was the mayor for 14 years before she defeated him. They're in the same Sunday school class, which makes it even more complicated, and her best friend is his wife. So that's, I don't know if you guys have some small town politics, that's what we're dealing with. And so when I had the seizure, we called it like the rescue squad probably back then. Volunteer Rescue Squad was really like the men's section of the Baptist Church choir. So we got Ross Strickland, everybody, these are the guys that hoist me away to the hospital. So within probably minutes, the other thing about my town is like my grandma had a police scanner that she would listen to for fun. I don't know if you guys anybody's from a place where like people have a scanner, so they got to know like what's going on. So probably within 5 or 10 minutes, everybody in town knew like something happened at the Brown house. What's going on. I wake up in the hospital, and I remember a couple things. I remember the family history part. I'm asking, anybody else in the family had a seizure before, had epilepsy? And I remember they mentioned like, his dad had some seizures, but like when he would drink. It was just like a throwaway thing. I don't know if you guys know like how we're not great at talking about epilepsy within families, but it was totally like, oh yeah, he had some seizures back then. Now looking back, I'm like, well, he was on meds for like 20 years. Like that would have been really useful data to communicate, but that didn't happen at that point. Our preacher, Mr. Pope, was there, which is kind of a funny name for a Baptist church preacher. But so what happens in this little town, I'm just getting video, is that working? It's just, okay. So Mr. Pope, you guys don't spread this, Mr. Pope goes back to my Sunday school class. This is all within, a few hours. And they're like, what's going on? What happened at their house? And he says, this is a quote from my neighbor, Patrick was puffing on too much of the pot last night. I don't know how that was his takeaway. And it's not even true. Not. So anyway, I'm in the emergency room, and that was my first seizure as like 16 or 17-year-old. The library, I'll get to, if you're like type A and you're counting all the stories, you're like, he's already at like 7. So like throw the 3 out. But those are my 3 big stories. So I remember, leaving the emergency room, I think they told me somewhere around there that was like a first seizure. I was going to get an MRI and an EEG, and that was everyone gets like a free seizure. I don't know if anyone's been told that. That's a crazy thing to kind of tell somebody, and I've told people that in my career as a doctor, but it's like, hey, this one's on us. Go about your life. And it's just not that easy. Like, it doesn't work that way. And so, but I remember I was a cool guy, like a football player. I thought I was a cool guy. The last thing I wanted to do was like deal with this. But I remember 1993, so I was going to the library to get some information. We didn't really have the internet back then. I think the next year, my teacher, Ms. Kinchlow, was like, we've got this great thing called America Online. I don't know if you guys even remember that. We got some people. But so I went to the library, probably drove myself to the library, and I was just trying to get some information. So I remember going through the card catalog. Anybody remember card catalogs? You don't remember card catalog? Really? Wow.
I work in a small town.
So all right, you go through the card catalog, and I'm like going through, looking for I'm gonna look at a couple books on epilepsy. And now in my mind, like, memory's a weird thing. So when I play back this memory, I'm going through the library and it's dark. I'm there alone at night, and it's like Harry Potter. It's like when he sneaks into the Ministry of Magic and he's looking for like the prophecy. But that's sort of what it felt like. Like, there's got to be a book on epilepsy here. And I found a book. And the only things I remember from it is that it mentioned Vincent van Gogh and Dostoevsky. And so with Van Gogh, I'm thinking, this is a guy that's a great artist, but didn't he cut off his own ear? And then Dostoevsky, I think I just read Crime and Punishment. So this guy writes books about guys that murder old ladies, for no apparent reason. So that's like what I had to look forward to. And I tell it now like it's funny, but I remember that feeling, and I think for me that library kind of captures the feeling of just being upside down, like so alone, lost, confused, with really no one to talk about it. I mean, you're not talking to your boys about the seizure that you had. And even to this day, if I talk to my neighbor, Brian Marber, he's like, remember that day that you died and they brought you back to life? Like, people don't even know in town. They're like, I was like this miracle guy. So with nobody to talk about, I just sort of went on with my life. And I did what most 17-year-old guys would do. I got a job that summer, a couple months later, as a lifeguard. That's true, and it's also funny. So you got, like, what's the worst job you could get, like a couple months after a seizure? Probably a lifeguard. And I didn't think either. I was like, oh, sure. So I'll go to a place where I climb up on the tall stand, twirl my whistle, and try to look out for everybody else. And I'm remembering that, and I was thinking, like, that's like a pretty good metaphor for your life, like, that's sort of what I've tried to do. Like, okay, I gotta deal with my own stuff. No. I'm gonna go and I'll take care of everybody. That'll work. But I'll work my therapy out later and not expose you guys to it. But that's what I did that summer. Really fortunate, went off to college, didn't have any other larger seizures. I was teaching school in New Orleans, a little summer program, and I was in front of a classroom of 6th graders. We were teaching chemistry, and they just wanted to make bombs, like, mostly. That was like their whole goal that summer, was like, are you going to teach us to make a bomb? And I'm like, yeah, we'll get to it. And I was in front of the group, and I was talking, and I remember, like, time skipping. Like, someone took the needle off of a record player and just moved it somewhere else. But I had no idea how much time had passed or elapsed. And so you feel, you're like kind of awkward. I don't know if anyone's had an absent seizure or any seizure like that where you sort of lose awareness and you're just trying to figure out like what. And so I had a couple more of those during college, and still didn't have an official diagnosis. And then right before med school, I decided for some reason I would get an EEG. Finally, that would be a good idea. And has anybody had an EEG in here? All right, we got a couple. Okay, so for the EEG, you want, are there any EEG techs in here? All right, well, so you want like a chatty EEG tech, so they can maybe give you, like, divulge a little more information, before you go and see your doctor. So I remember laying there, I think my girlfriend at the time was with me, and I'm asking the guy, I've got all the electrodes on, and I'm like, hey, how we doing? Everything good? He's like, yeah, doing fine. And then they have you hyperventilate. And so trying to bring out seizures, I hyperventilate, and I say, hey, how we doing? Everything fine? He said, yeah. And then they did the flashing lights. They do a flickering light, or photic stimulation. And I remember being a kid, like the light coming through the pine trees in North Carolina just hurt. It was like painful. And I thought, well, it just hurts everybody, right? And so they did the flashing lights. And I'm like, oh gosh, that felt a little weird. I said, how we doing? Everything good? And the guy goes, your doctor will speak with you shortly. I was like, oh, okay. So there's epilepsy. And so that's right before med school. And I don't remember like the specific diagnostic talk or anything like that. I just remember feeling like I've got this secret that I've got to carry, that I've got to keep. And it's interesting. I just talked to a guy, and I love that you guys are here. If you have epilepsy or if you're just involved in epilepsy, this is amazing that you could just come and like talk to people and meet people. And I just encourage you to meet as many people, hear as many stories, and share your story with as many people as you can. But just talk to a guy that's a neurosurgeon that had benign relentic epilepsy, and he's like, I don't really say anything about it too much because I interviewed one time. And I told a neurosurgeon that, and he said, never tell anyone that ever again. And it's amazing, even within the world of medicine, how, at some point I think, like, what's my problem? Like, why wasn't I just more forthcoming about things? Why wasn't I okay to say, I have epilepsy? It's taken me, so long to get to a point where I can just, like, okay, that's part of me, right? Like, I have epilepsy. I have other things too, like, I have a really good forehand in pickleball. Not just kidding, I don't play pickleball, I play tennis. But I still have a really good forehand. So I have lots of things. But it felt like such a big, heavy weight that I was carrying for whatever reason, that I didn't really talk about it in med school. And I told maybe a few close friends, or had to navigate some of the things that, folks with epilepsy do. Like, okay, you've got a girlfriend and you may be like, how do you tell her? Like, well, maybe if I have a seizure, like, how do you broach that? There's all these little nuances to epilepsy life that no one really talks about. It's like, well, I'll be taking these pills at night, and but besides that, I didn't really share much of it in medical school. And then I decided to be a child neurologist, and people still ask me, like, well, did you go into child neurology because of your epilepsy? And I still say, not really. Like, that's the dumbest answer. Of course I did. It's so stupid. Like, of course I did. We are mysteries unto ourselves. But, and I was just talking with a neurosurgeon about this. And my personal statement said nothing about epilepsy, which is, you have to write a personal statement applying to residency. And my personal statement was like, it's like I was trying so hard not to mention it that it was like a ridiculous personal statement. Like hiking the Camino de Santiago in Spain, like it had nothing to do with, like I should say like, hey, I have epilepsy, I care about patients with epilepsy. I think I'd be good at taking care of them. Like let me into your program. But I didn't, and that was, still a few years down the road. So I went to Houston. You guys aren't. There's no quiz on like following my where I've moved and lived. But I went to Houston and trained at this great hospital, Texas Children's. And I remember like as I started as a child neurology resident. I live now, no quiz, in this town called Hudson, Ohio. And Hudson's known, we have one kind of famous guy that lived there, and it's John Brown. So if you know like your history, John Brown had like the raid on Harper's Ferry. And he made this, there's a church like 2 minutes from my house, where he made his stand, where he was just like, I'm gonna spend my life, fighting against slavery. Like that's what I'm gonna do. And so, I'm not comparing myself to John Brown, and we're not related. But I remember, like, when I was a resident, I remember thinking, like, I'm a child neurology resident. If I can't be comfortable telling people I have epilepsy, then who can? Like, how goofed up is that? And so I told my group there's 4 of us that were interns on the neurology floor, my intern year, and I was, like, so proud of myself. Like, I got it. And I told them, And I just sort of sat back to see how they were really gracious and great. And then there was a fire drill, and the fire alarm went off, and it's flashing. And these sweet and gracious residents like ran over to me, and they were like, "Hey, are you okay?" And tried to like shield me and protect me from the flashing of the light. And I was like, "I'm fine. I'm okay. I'm good. Thank you." And then rounds maybe later on that month, a doctor came, and he said, "We're going to have Patrick demonstrate for us the hyperventilation technique on this tissue." And they were all like, "No, not Patrick, anyone." And he's like, "What's wrong with this guy?" And so I tell you that just to sort of, I don't know if sometimes we don't talk about epilepsy or our own epilepsy because we don't want to be treated differently at all, right? There's that sense that like, well, I can still do this stuff. You don't have to treat me or handle me with kid gloves. But, I had made some progress at that point. We had, I hope you're not counting the stories because you're like, oh gosh. We had an epilepsy attending that's still one of my favorite guys. We were on rounds, so the rounds, there's like 10 or 12 of us. It was a big team. And I'll never forget, he knew I had epilepsy. He was great. I told him about it. And we're on rounds outside of a patient room, and he says, now you know that, teaching the team, you know that seizures don't make you smart, and you know that seizure medicines don't make you smart. And I'm like, hello there. I'm your dumb or non-smart resident, I guess, And there's so much stuff that you kind of pick up on. But for the most part, folks were great. And that was that. Now, I got a chance when I was down there to be one of the camp doctors at this camp called Camp Spike and Wave. So you can laugh. That's a funny, cute, clever name. But it was a really fantastic camp that they have outside of Houston, maybe closer to Austin, I think. Yeah. It's
where they make Bluebell ice cream.
Bluebell, yeah. And it's Camp for All is the site, but it's a really wonderful camp. But I went there, and one afternoon they do a younger camp and then an older camp. So this was sort of the younger kids. The camp director said, "Would you mind sharing your story with these kids, after lunch?" And I don't think I'd ever shared my story. And so I was probably terrified, but I said, "Yeah, that's fine." And it was sort of a similar thing. Like I had a microphone, and we're sitting around outside. We shoot the scorpions away, and I asked the kids. It must think of them as third graders. I said, "Who here has epilepsy?" And like every hand, went up. And I said, "Now, if your teacher at school asked you the same question, how would you feel? Would you be able to raise your hand like that quickly, or would you, be willing to raise it like that?" And one kid said no, because I'd be the only one, or they don't stare at me, or something like that. And then I asked them to raise their hand again. You're like, "That's redundant. Why don't you just?" But then I raised my hand too, and I shared with them a little bit of my story, probably faster than I've talked to you guys. But and the coolest thing happened, I think, in me sharing. They all wanted to come up and tell their story too. And so these kids kind of came up one by one and got the microphone, and they just had the best time. They were like, "One time I was at the bus stop and I had a seizure," and they were trying to one up each other. One was like, "At the baseball game I had 2 seizures, required rescue," but it was this great community, where everybody felt like they belonged. And that was the first time in my life with epilepsy that I felt that. And I'm not lying. There was like a healing balm almost just in that community. And I think maybe there were 2 components to that. Like me, maybe having the guts to just share and open up. I feel like if I start sounding like Brene Brown, you guys can just make a hand motion. But also I think just being with other people that I thought were, these are my people. And they were third graders, which was kind of weird. But that was a really powerful moment for me. And then, are we doing okay on time? After that, I left Texas, went on to sort of practice medicine as a pediatric epileptologist. So you're trying to figure out your way. If you guys have seen different epilepsy doctors. We're weird, like, epilepsy doctors we're a weird bunch anyway. And I was just trying to figure out, like, what I look like as an epilepsy doctor. So I had, like the whole thing, like the bow tie, starched white coat, so good, like, so not me. Like, if I'm in practice, I have like Hawaiian snap shirts and stuff. Like, my mom told me today, the mayor, she's like, I'll tell you this too. My mom has this weird thing. She feels like she'll try to like channel stuff, and she'll tell you that like God's telling her this. So it like increases her maternal power. She's like, well, I was praying this morning, and God told me you need to dress neatly for your presentation. I'm like, I don't know. Like, I don't question her anymore. I'm like, was he like specific? She's like, yeah, I was getting like suit or like blazer. So I hope like she never sees this, because and then of course like all the other guys are wearing suits today. So, but I was trying to figure out like what do I look like as an epilepsy doctor, and then how do I integrate my own story in a way that's helpful for people, but also not like I don't want to be like the therapist you go to who just tells you all about their problems, because that's not why you're there. But I was there one day, and there was a knock on my door. Third story, we're getting there. There was a knock on my door, and it was one of my colleagues, and they came in and they said, hey, I was talking with our chairman. I'm like, oh God, okay, what did I do? Like, I'll sign the reports. Sorry, I know the EEG notes are late. But they said, no, I was talking with our chairman, and he told me that you had JME, which is juvenile myoclonic epilepsy, which is the specific kind of epilepsy that I have. And I'm like, oh gosh, like, here we go. And I was just like, trying to be bold and talking about things a little bit. And then they said something that I'll never forget. They said, so do I. And it, like, wow. Like, I had to sit with it for a bit, because that was, something that for me, I felt so alone in this, and even alone in this like pathway of like, I'm a doctor, take care of people with epilepsy, hiding my own epilepsy, which is ridiculous, and trying to like come to terms and integrate the stuff, to know there was someone else doing the same stuff I was doing and had walked a similar path. So I'll wrap this thing up here shortly for you guys, but I think for me, the friendship and the relationship that came out of that connection, or out of that so do I kind of moment, has really probably been, like, if I gave you guys the cliff notes for this thing, it would be the isolation and the loneliness that can come from living with epilepsy. I feel like the antidote to that is a real connection. And even just something as simple as friendship. This is like, we're just being human, right? We're just learning how to be humans. Like, I'm just learning how to be a Patrick, I'm like, it's not easy. It's like, being a Patrick can be hard sometimes, right? And you guys are just learning to be, if I remembered your name, I would say,
Scott.
We're all just learning to be a Scott, right? And we're still all just growing up, and that's okay. But don't, the power of your own story, I think, has the potential, and the power of that connection has the potential to change somebody's life. I was looking through, I have these old notebooks, I don't even know where I had the quote from, but it was said, every time you change every time you meet someone new. Something I never heard that before. I mean, I guess I'd heard it from somewhere because it was in my notebook. But you change it. Well, how about that? And that's really like, that's all I really have to say, is that I don't know if you've had a chance to have a moment like that, or if you've had a chance to be a part of that connection. I mean, part of what I really hope people, and this is great for me to see, it's great for me to be here with everybody today, just as a part of it, right? I want to just rip off the stupid like doctor tag. I mean, you guys go, like, there's the American Epilepsy Society, and it's like you want to see how many different, what are these things called?
I don't even know.
I don't know whether, like, you see people like 13 of them hanging down here, you know, like doctor, speaker, chairman, co-chair, and it's like, just take it off. Like, we're just a guy with epilepsy, right? And so, I'll tell you one other, it's like a kind of bonus story for you. One of the first times I had to give an epilepsy talk was back in 2015. And I was in Minnesota practicing there. And it was my first like public talk, I think. My wife always hates when I have to give a public talk because sometimes we'll prepare for it, like it's gonna be a TED talk. And there'll be like, 4,000 people in the audience. Or it's like the Super Bowl halftime show kind of thing. And I was really, really nervous to just be in public and say, I have epilepsy, and to talk about it. I couldn't just naturally talk about it. It was so weird. But in preparing for the talk, I was in Minnesota, I had a big beard, and so you had to like manage my beard before the talk. So I went to the barber, and they're like, the barbers will give you a beard trim. And so I remember like laying back in the barber chair, and the guy was like, what's going on? What are you doing this weekend? And I said, well, I'm giving this talk, I'm a pediatric epilepsy doctor. And I could just hear me being like, you're too wimpy, you're not gonna say it, you're not gonna say it. And I did, I said, and I have epilepsy, so that's what I'm gonna be talking about. And the guy was staring at me. He's like looking down, he's got the clippers in his hand. And he goes, epilepsy? I have epilepsy. And I was like, no way. So we made this connection. I had to put my money where my mouth was because he had the clippers, did a great job. And then a little bit after that, I went home and was talking to our neighbor, Dan and Pam. And Dan said, well, what are you doing this weekend? Same sort of thing. I said, well, I'm giving this talk. Pediatric epilepsy doctor. Dan knew that. And then I said, but I have epilepsy too, and that's what I'm talking about. And Dan goes, Pam has epilepsy. She's got a heterotopia. She crashed her car right before we met. And like immediately, it was like the minute I started talking about it, everyone either knew someone that had epilepsy or had it themselves. And so I feel like that's a little bit of the land that we live in. And I don't know if you've experienced that or not. As you've sort of opened up or started to make connections, you realize like we're not as alone as it may feel sometime. And that's really all I really came to share with you guys today. So I'm happy to take any questions if you have anything. But thanks so much for coming. Appreciate it. Or if you just have a cool story you want to share.
Okay. Like, I want you to I'm here from Kansas City. And the first thing you said when you started talking was you're on your path to make peace with this journey. And I wrote that down because our foundation is Purple Peace Foundation, and that's exactly why we named it that. We had lost our daughter to epilepsy, and it was the peace. She had peace signs all over her room, so that was our nod to her. But it was also because it was peace. And like everything you have just said is just totally our mission and purpose for doing this is getting those people together, bringing families together. We started this, she died 12 years ago. We started it basically a few weeks after she passed away. We did our first event because we wanted just to remember her. It was her birthday, it was Epilepsy Awareness Month, and we did this, and people started coming out of the woodwork wanting to connect because we said she had epilepsy, and they're like, I had epilepsy. I didn't even know this could happen. And all of these things. So we started our foundation because of that, to build those connections. We've been coming to this event since they started having this expo, and it's just exactly what you say. My husband says it every time he goes somewhere. He was at the barbershop last weekend and told them we're getting ready to go out to California because we are going to this epilepsy awareness. And the lady that was cutting his hair was like, oh my gosh, my nephew has epilepsy. And everywhere we go, there is somebody that we connect with. So we go to our local area fairs, during the summer and set up a booth. And we did the first one this summer, and I can't tell you how many, we had 30 people stop by our booth in the matter of 3 days, and we're like, oh my gosh, I have epilepsy. And so, I mean, just everything you said, spot on. I felt such a connection. I had to share that with you. So,
We planted her in the audience. It was like, that's good. No, it's so true, and it's like sometimes you just have to take the first step. You know, it's just like even if it's like a really awkward step. I was talking with Candy, who's organized this thing, and last night, and it's just trying to like open up and just get it out there, even if you're stumbling and whatever. But I told her, it was so hard for me to say, like, I have epilepsy, for years and years and years. And so, thank you so much for sharing that.
I have a different perspective. My 2.5-year-old daughter has Dravet syndrome. She has epilepsy. So kind of I want her to be able, as she grows, to have her own journey with it. But then also I think I've learned through Dave Dravet yesterday how important advocacy is, just to put a name to her syndrome and to even bring awareness to it in general. But I was curious if there's any other parents in the room, how they've navigated that, if they have young kids, to allow her as she grows to have her identity, and come to peace with it, as well as being a parent who doesn't know what that feels like to have epilepsy. I'm just curious if anybody has any feedback to that. Okay, great, thank you.
Yeah, that's so great. And I think the other thing too is that one reason that I was sort of hesitant to talk, and sometimes still, is that epilepsy is so many different things for so many different people, right? And so the last thing I want to do is sort of hold myself up as like epilepsy looks like me for everyone, right? Like that's not it. That's not true. But I think we all have our journey. Sounds corny in some ways, but I think that's true. Like we all have our own path, and so I think it's fantastic. Yeah, if you guys can connect to.
I'll put out there, as you were saying, to kind of piggyback off of you, and I'm terribly sorry for your loss. I have a 4-year-old. She's also got a rare disorder, obviously epilepsy. But what I find fascinating about your story as a parent is that while it's hard, you're willing to share it. The journey sucks, but it's encouraging and it gives faith that there's normalcy that can come with it. And whether it's talking about it, whether it's sharing it, but also them growing up and them having the opportunity, because it's so stigmatized that it is just one thing, and often we don't have that awareness for SUDUP and all the worst case scenarios. But I also have a nonprofit for my daughter, and I remember breaking down one time and talking with her father and saying, it's the stories, they become important and they matter after they pass. Their story doesn't matter up until that point, and then after they pass, then people listen and they hear the awareness. And I look at what you're saying and I feel like there's just so much more to that, and there's the ability for advocacy and sharing their story and putting the information out there, and we're at the prime point of doing that. But it's people like you that give us that faith as either the individuals who have epilepsy or the parents who are helping them, or guardians, family, helping them through that process. And I think that's vital. So don't stop doing these talks and continue your comedy hours.
I was testing news here. Yeah. Oh, good.
Like you gave me hope. I have a daughter that was diagnosed with epilepsy when she was 3, and they were described as different kinds. Once she started off with absence, that she would outgrow it, then it was a tic, taken off her medicine, then she had her first grand mal, and then when she was in her late 20s, she was diagnosed with Javon's. Her neurologist never heard of it, didn't believe it. She's 38 now. She was finally confirmed, she diagnosed herself. But there is such a stigma, like when she signed up for, what was she doing? Wanting to become a lifeguard. She didn't tell anyone, she didn't tell them she had epilepsy. Even when she was just recently, probably 4 years ago, there was a stigma. She was in nursing school, and we live in the South, so things are a little bit a little bit slower there, but we live in South Carolina. But anyway, she she had all A's, she had this director of nursing who said, you know, I have to approve you for the boards. You know, you can be straight A's, I can flunk you out, you know. And she made it very difficult, so finally my daughter gave up on it. And she hasn't gone back, she may. But you gave me hope. There's so much stigma, and then the parents are also think, you know, they're subject, well, if she does go back and she starts having uncontrolled seizures, you know, then you lose your disability. And so we have a long way to go. So those with you young children and stuff, you know, trying to be the advocate now, because it is getting better, but you really do have to push. And it's really hard when you're making decisions, well, do we lose our health insurance and she goes backwards, or do we lose our disability? So, just some food for thought. Thank you.
Yeah, thanks so much for sharing that. Yeah, and I've got a website that I'm starting. I don't know what I'm really doing right now. I want to come up with some way to be like an epilepsy coach. Like I feel like families, like say you're first diagnosed and you're like trying to figure out where to go, who to talk to. There's so much information on the web, but some of it is like just too much to process or figure out. So I don't know that that's really like a role, but I'm trying to figure out a way that like I could offer, yeah, as a guy that knows a little bit about epilepsy and can, especially for kids with epilepsy, someone to maybe help walk families through that in some way. But I've got, you can go to patrickbrownmd.com. There's nothing, it's just like my picture, and you can put your name in for a newsletter that I'll just, probably as I come up with stuff, I would love to just, you know, keep in touch with you guys and keep hearing your stories and help you. If there's anything that I can do to help you, just get in touch with me.
I just really wanted to say thank you, because listening to you speak up there was like listening to my life in review. I had a really well kept secret for about 28 years until I had a seizure on the job. But what I want to say to the moms and the parents and the caregivers out there, I never got my diagnosis until I was 28, so and I had already lost my mom, so I can't get her feedback on it. But I've met Marla here, who is a mother, and I can tell you as somebody who has seizures that it's much scarier for you to witness them than it is for us to have them. So I just advise you to find a group of caregivers or parents that you can relate to, because you really need to have a support system there for yourselves.
Yeah, and I've heard that a lot, like people end up diagnosing themselves with, and I think my formal diagnosis as JME, like I sort of just came up with myself as like a med student. I'm like, oh, these 3 types of seizures, this EEG, because I had like a country neurologist, and it was just like good old primary generalized epilepsy. So now, like with my doctor hat on, I'm like, we need to have the most specific diagnosis for you so we can take the best care of you, you know, possible. So, yeah.
I have a 12-year-old here, and about 3 years ago he was diagnosed with autism and ADHD, and I was like, I knew he, you know, since he was little that he was different. And then in 2022 he had his first grand mal seizure, and scared the heck out of me because I never knew it was gonna happen. And the first day of school, he had it in July. And then, you know, he goes back to school, and the first day of school, I'm freaking out, because I'm like, it was only a few weeks ago he had it, and I'm like, I'm sending him back to school, you know? And I made the mistake of telling the kids that, because there was a substitute, and he was late, and I said, my son has seizures. If he has a seizure, you have to put him on the side, and he has medication in the office. And my son had a total meltdown after that, and the kids started making fun of him the whole year, last year, because of that. And he didn't want to go to school. I'm sorry. The diagnosis of autism is already hard enough. And then to have kids make fun of him because he has seizures was worse. They didn't know he had autism, and then they just knew that he was different and treated him differently. And then when they found out he had seizures, they just made it 10 times worse, to where my son didn't want to go to school and still doesn't want to, even though he's in a whole new school. So coming out that people don't want to talk about it, I totally get that.
think everybody here feels you. I think we hear you, and man, I bet a lot of us have been in that similar place, and it's tough. You know.
He doesn't ever like to say, he doesn't tell anybody.
And I think for
Everybody try to say it,
yeah, and I think I was talking with someone else who, especially guys for whatever reason, like teenage guys especially, boy, are not excited to talk, right, about this stuff. And then if you throw in autism, a whole other, you know, set of complications, right? And so for you guys, I just would hope that you've got people to be with you, to help you, to like this guy right here. Oh wow, you really have people. Look at that guy. Wow, we need more guys like you. And so to literally be with, we talk about like people being with us, or you know, standing with us. Like this guy literally is here. So that's awesome. And thanks for sharing that. It's, you know, he is. Yeah, I think, and from what I've seen on the other side of things is that parents, oh my gosh, like you guys are incredible. I've got 3 kids. I've got a 14-year-old, 11-year-old, and a 9-year-old. And I think the most heart-wrenching thing is to feel like these are a stupid thing that doesn't even come close to anything you're feeling. My son, Ben, is 9, and he's so excited about this Demon Slayer costume for Halloween. It's got like these little earrings, and he's so excited. It looks great. But I know that his buddies, they're going to be like the soccer player guy with a horse head on. And I know like he's going to get just ripped if he goes, you know, he's going to go trick-or-treat with these guys, and they're just going to light him up. And my heart, you know, your heart as a parent is like, you just don't want anything, you know, bad to happen to your kids. So that's a terrible example, but like, yeah, it's like your love for him is so apparent, and you know, our heart goes out to you. Anybody else? Oh, sorry, I'm standing right in front of this. Good. Oh yeah. I thought we could keep the room as long as we want since they went over a little bit.
Hi.
Hey.
Your story really connected to me. The week before I started middle school, I had my seizure and was placed in the hospital to figure out what it was. So all my friends got to start, and what would be my new friends in middle school got to start a week ahead. And I was behind ever since in regards to connecting with people and figuring out what epilepsy was, because of course I was at a time where I had to look at the Dewey Decimal System. There was no internet. I don't think I really had a true understanding of having epilepsy until I was in college. And I had a real hepatologist at a level 4 system. And I had loss. A lot of loss that people didn't understand. You know, to lose your driver's license, you had employers to deal with that didn't understand. It's brutal. I had a recent surgery, and I told my family that wasn't comfortable in my skin because things had changed again. But I really appreciate you talking about having epilepsy and going through it, because I have epilepsy too.
So, I think just the bravery sometimes in just saying it, and like everything we've been through, that we can tell even in just a minute or so, and just knowing like we're family. I think, you know, we're family, whether we like it or not. It's like I'm like maybe the goofy uncle or whatever, but yeah, I think we're family, and sometimes it's just really good to know like we've got family in this and this. Anybody else? I think we'll let you guys get some lunch, and then yeah, again, PatrickBrownMD.com. I've got cards if anybody wants to come see me after this, but just put your email in, we'll connect, and I'll see you. I think it'd be good to keep in touch. And thanks so much for coming. Enjoy the rest of your time.